My name is Johnny Palka. I am a longtime professor of biology. I retired from the University of Washington in 2002. My day is centered around walking and photographing in nature. It is an immersion in nature walk with the connection being made through the camera. And I, over the years, have gotten to see things, pay attention to things that before I started doing this on a regular basis, I would just have walked by. I just simply would not have seen them. I started having heart issues around 1990, and it started with high blood pressure, and then I developed atrial fibrillation. And it turned out that the regurgitation through my tricuspid valve had suddenly jumped to the top of the scale in the space of 1 year, and it was described as torrential, and it needed immediate treatment.
I first met John in 2019. He was very typical of a patient with tricuspid disease. What tricuspid regurgitation does is it causes a leak in the heart. At his age, the options can be quite limited. So most patients like John are not offered surgery for their tricuspid valve. They're just offered continued medical therapy.
Fortunately, the Heart Institute was in the early phases of this clinical trial, and I applied to be a patient in that trial.
TriClip is a really novel procedure. It's a procedure in which we use a catheter and we go through a vein in the leg, and we use it to repair the valve in a way that the leak is better. With the tricuspid valve, one can see that there are 3 doors, and they can be viewed as flaps that are flapping in the wind or flapping open. The clip is like putting locks on those doors such that they stay shut. 3
or 4 years earlier, it would have been fixed with open heart surgery. I would benefit because it would be a hugely less invasive way of fixing a life-threatening problem, and medical society at large would benefit from having a patient.
People like John have now opened the doorway to have options that are now available to treat patients with these symptoms that otherwise would be written off.
Research is how we move forward. So being part of a clinical study is a contribution to the growth of that field of medicine.
John's prognosis is outstanding. He has excellent heart function. He's got a great tricuspid valve now that's not leaking. And as far as I can tell, he's doing much better in terms of his quality of life.
If my cardiac condition had been allowed to deteriorate, well, I might not even be alive to begin with, but I surely would not be able to casually go out and walk miles in nature every day. The mere fact that this was available through the work of the Minneapolis Heart Institute and its foundation, that's just a blessing in my life.